Dr. Zeev Neuwirth wrote one of my favorite healthcare books, Reframing Healthcare. He followed that up with another book called Beyond the Walls, and now he is launching something new called Humanistic Rebel Leadership. I can't wait to find out what that is. Let's get to it.
Swaay.Health.
Dr. Neuwirth, welcome to the program.
Thanks, Colin. So great to speak with you.
It's always fun to connect with you. Thank you again for all your friendship and all your knowledge that you shared over the years.
Thank you.
I'm excited to get together with you to talk about this.
Yep.
Health Rebel Leadership.
Yes.
Tell me more about what that is.
Yeah, so hashtag HRL, it's actually Humanistic Rebel Leadership. And the way it came about is over the past year, I've been speaking to groups about my most recent book, Beyond the Walls. And there were a couple of observations that really became apparent to me. The first was people would say to me, Zev, this is the right thing to do. This is the right direction. The current healthcare system is unsustainable and it's worsening across the board, every metric. And the problem is, what can I do? What can I, as a doctor, as a nurse, as a clinician, as an administrator, as an executive, even as a CEO, what can I do? And I heard the same comment, the same question over and over again. And I tried to massage it. I tried to come up with answers and responses and here's what you could do, but it just wasn't a satisfactory thing. And so that was observation number one. Observation number two was that observation number two is that there were two types of people that kind of responded. One was the sort of like throw my hands up in the air. And the other was, I'm going to, for lack of a better word, I'm going to rebel. I'm not going to toe the party line. I am not going to go down this dystopian pathway. I am going to be thinking and doing something differently. And I really saw these two different camps emerging. And I was sitting actually with one group of young executives in healthcare one day, about a dozen people around the table, talking about the book and talking about their ideas. And it all of a sudden, I just turned to the group and I said, oh my God, this feels like you're like a rebel leadership group. And they all looked around and said, yes, we are. And these are well-established leaders in large healthcare systems across the country. But it almost felt like meeting with the founding fathers of the US. It's like, or the founders of the US. It's like, it was like that moment of like, these are leaders and they're established and they're business people and they're executives, but they were also rebels. And so I began to realize that if we really want to change healthcare, we need to have a rebel mindset. And so I actually started to codify the difference between the standard mindset, the legacy mindset, and the rebel mindset. And I actually have now probably a dozen very, very distinct mindsets and approaches that these two camps have. And so I'm carrying this sort of like rebel leadership thing and this sort of humanistic thing and the what can I do? And I also one day, someone asked me that question. It was like the 100th time I was asked, but what can I do? And I realized, oh my God, you're absolutely right. I cannot do anything. I cannot, the system's too big, but we can. And then it all of a sudden clicked. If we got these humanistic rebel leaders together in a network and they were able to talk and compare notes and say, listen, I've got a project I need your help with, or I have some ideas I'd like to run by you. If we can get that group together, we actually have a fighting chance to change the system. And so I decided to create this online community called Humanistic Rebel Leadership. And we just kicked it off last month, so it's pretty new. I'm putting some content on. I'm basically interviewing rebel leaders, humanistic rebel leaders, and doing short clips of them. I'm actually going to start something now, which is basically an open forum. It's going to be like a Zoom session where a humanistic rebel leader will be on, and whoever wants to join, if you're part of the community, you could come on, you could ask them questions, you could compare notes, you do whatever you want. It's going to be an open forum. So we're starting that, and also the site has conversations, or what they call collections, where if you have a project you're working on or an issue you're interested in, you can start a thread And people who are interested in that can join that thread. So for instance, someone reached out and said, I'm a national authority on resilience and burnout, and I'd love to actually start something on the site. And I said, go ahead. You're the leader, start it. It's, I'm not going to control it or anything like that. We're just going to manage the site. But so I'm really excited about that opportunity to give, folks who are humanistic and are rebel leaders in healthcare, sort of a home base, a site where they can go and feel safe because they know the other people there are there because they have the same sort of directional intention of really humanizing healthcare. So that's kind of what's going on here.
So Dr. Neuwirth, this is very exciting. I mean, I'm excited for you that all these things are going to be there. What are some of the outcomes? What are you hoping that someone who joins this rebel group will be able to get from being part of the group?
Yeah, so it's really interesting, Colin. I've had a lot of folks call me up and they're like, listen, I just need to talk to someone who has this mindset you have. I just need an ear. I just need to bounce something off of. Or quite honestly, I'm just feeling like I'm about to give up. I cannot tell you, Colin, how many leaders, and I'm talking physicians, executives, who have called me up and said that. And of course, I sit with them and I listen to them. But I think to myself, oh my God, if you had a community where you could say, listen, I need some help. And it's not just one person responding, but you have hundreds of people who could respond at different times and in different ways. And then of course, part of it is also, I want to be able to give them something back. So for instance, an executive called me up and said, I have this startup and I want to help. And it was about helping Medicaid patients, in the inner city. And I've got this idea and I just need people. And so, that would be so powerful if they could literally, if this site was fully grown and there were literally thousands and thousands of people, and they could have gone on and said, listen, I'm looking for a few good people who are interested in this particular initiative, this company I formed, who is interested, and that's the kind of, there is a very, very concrete, substantial, sort of what's in it for me component to it. I really believe that action is what we need. And in order to achieve the type of action we need, you need to have a certain size, if you will, a certain momentum, a certain number of people. And, again, it goes back to this thing that networks and community. I mean, it all happens in community. You cannot change the world by yourself. Right?
It sounds like what you're building is it's part lifeline for people who need it. It's part community for those that need the support and sort of that push to kind of make real what they've maybe had in their mind, and part I'll call it party in the sense of finding your tribe and having like-minded people to be able to motivate you along with them, and to be able to take part in some of these activities that maybe you want people to take part in.
And I would say it's also, I love that. I'm going to have to listen to this and write down what you just said. I think also another part of it is I'm interested in this. And I'm looking for something. And I think for those people, it's a great sort of platform where you have people who are looking for people and are people looking for a mission or a purpose, and you combine those two together. And then the other part I want to say is that this is not just for professionals in healthcare. I want the voice of, as many different stakeholder groups, whether it's economists or policymakers or people who deal with, education or just, health is so much bigger than the traditional healthcare system. Patients, family members, caregivers, we need lots of voices. So I'm hoping that people will hear about it, join, and I think, again, a movement needs people, and that's what essentially this is.
I would be remiss if I didn't at least ask you about your book and talk about, we spoke last time about your book.
Yeah.
What's next in terms of, are you working on another book? Are you doing more speeches on this one? Tell me a little bit more about that.
It's both. So I think that gratefully there's a lot of interest in Beyond the Walls, the book that came out a year ago, as well as Reframing Healthcare. I think it's interesting. I had to go back and read the first book before I completed the second book, and I thought to myself, oh my God, there's so much good stuff still in the first book that we need to be thinking about and doing. So I'm still bringing out these concepts. Fundamentally, I still believe this to be true. we are stuck. It's a largely, I think, a conceptual trap. We don't have a good metaphor. We don't have a good way of thinking of healthcare. We're still stuck in almost an industrial model of healthcare delivery. Even the word delivery, as if you can deliver health. We don't have. In fact, Colin. I was at a symposium a couple of weeks ago in Boston, and I was facilitating a panel discussion, and I turned to these experts, and this was in artificial intelligence and the deployment of technology in large healthcare systems, and they were all senior executives in this realm, and I asked the question. I said, I know this is kind of a non sequitur, but what's the metaphor you use for healthcare? And totally stumped them. There was not one response. 3 panelists, and these are brilliant people, and literally one finally said, I got nothing. And I think that is, if we don't have an answer to that question, then what are we doing, right? What's your metaphor? What's the narrative? What's the real thing that you're doing? I think we're in that sort of crisis right now in healthcare, and so that's. And you ask what I'm doing next. It's along those lines. It's actually looking for. It's really interesting, actually. It's like I've never heard anyone actually ask this question or pursue this. But what's the metaphor in medicine? What is the next metaphor that we need, or what are even the possibilities of metaphors? So yeah.
Wow, I'll be interested to read that one. And yeah, Reframing Healthcare is still one of my favorite books.
Oh, thank you.
This one is excellent as well. And
Thanks.
so happy to hear that you're continuing that journey and
Thanks,
coming
Colin.
up with the next one. That'll be a lot of fun.
Thank you, Colin.
Where can people go to connect with you, Dr. Neuwirth, and where can people go to learn more about HRL?
Yeah, so hashtag HRL is up and running. You can join as a member through my website, Zeev Neuwirth. I think it's ZeevNeuwirthHealth.com or Zeev.Health.com. There's a couple of ways to get to my website, but if you go to the website, membership is right there. You can click the button. And I will say this, and I just want to be upfront. There is a monthly fee. It's I think it's pretty minor. 2 or 3 cups of coffee. If you skip them, we'll pay for the month. Actually, probably less than that. And but I really felt like it was important to actually make it a membership site. It was really like, are you committed to participating in a community? And I think there's a sense of giving to the community, to be part of the community. And so it was as much about just funding it and resourcing it as it was around really creating this sense of, I do want to give to the community. I want to be part of this community. And so I just want people to be aware of that.
Dr. Neuwirth, always a pleasure to have you on the program. Thanks for coming on camera with me.
Oh my God, thank you, Colin. Always a pleasure.
Hey, I want to thank Dr. Neuwirth for joining me on the program today to talk about humanistic rebel leadership. It's an intriguing concept that combines a support group, leadership forum, open source learning, and good old-fashioned networking. And hey, if you enjoyed this interview, please help us out to produce more interviews like this by mashing that like button and subscribing to our channel. Also, head on over to Swaay.Health, that's Swaay with 2 A's, .health, where you can find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next episode.